Hi, it's Dr. Rosario from Inver ENT and Sleep Center. Thank you so much for choosing us for your care. This video is made to reaffirm some of the things we talked about in the office, so you have another place to go to and answer your questions or figure out, what did she say? Was I listening? Did I get that quite right? So just another resource for you. So this time I'm going to talk about ear tubes. So with ears, we're doing ear tubes because of recurring infections, because of decreased hearing, or just fluid in the ears, which is a chronic infection. And so your child or you as an adult have ear tubes in place. So how do I take care of ear tubes? They're pretty simple. So when the tubes are in place, there should be no drainage. Anytime you see liquid or what looks like snot essentially coming out of the ears, that would be the sign of an infection. Sign of an infection would mean you need to have it treated, and usually we're using antibiotic drops. If your child is sick all over, they've got a runny nose, they've got a cough, they've got a fever, then it's more than just an ear infection. So we'll do antibiotic drops, which, don't be alarmed, most of the time they are eye drops, but you're putting them in the ears. So not a mistake, eye drops oftentimes are being put in the ears. So we would give them an eye drop for the ears to treat the ear part of the infection, but they might also need an oral antibiotic. Trying to minimize them getting an ear infection. If you're well and septic at home, have them with baths, not lay down in the water to get as much of that water in, because it is not chlorinated, much more likely to get an infection. Same thing with lake water. We want your children to not feel restricted, so if they do lay down in the bath, or if you're at the lake and they're going in and out of the lake fairly often, then at the end of the day, use some of the drops that you were prescribed after surgery and just rinse the ears out. You're just trying to decrease the amount of bacteria from the lake that's staying in place, which would increase their risk for an infection. The younger kids, for sure, no earplugs, because they don't listen. They often don't swim very well, and now we plug the ears. So from a water safety standpoint, not ideal. Much prefer to treat the infection afterwards. So just using the antibiotic drops afterwards. In a pool, the pool water is chlorinated, so less likely to get an infection. So for the most part, after pool swimming, you don't need to use any of the drops. Again, excited to be a part of your care, and we look forward to continue to taking care of you.